the most common causes of disability in America. Millions of Americans experience it. So we're talking about back pain. It can range from debilitating to something that's just kind of a nuisance. But the Cleveland Clinic's Center for Spine Health is now taking a different approach on treating it, one that helps address the mental side of the pain. We're joined now by psychologist Dr. Sarah Davin at the Cleveland Clinic, who can help shed some light on alternative methods for treating back pain. Thank you so much for being with us, doctor, this morning.
Thanks for having me. Good morning.
Good morning. So we're going to start with some of the main causes of back pain. What do you typically see, and how debilitating have you seen it be for some people?
Back pain is incredibly common, and I think that the causes range just from being active and wear and tear over life to sometimes acute injuries. Certainly, back pain can get in the way of living a life and doing the things that you want to do, and that's where our comprehensive team that involves behavioral components of care really takes a look at the whole person to help them get the best quality of life they can, be it if they are going through surgery or just wanting to manage it on their own. We're there to really provide a very whole person approach.
Okay, so a lot of times when someone's dealing with an achy back, you pop a painkiller, but the clinic is now focusing on alternative therapies. You touched on it. Can you talk about that a little bit?
Sure. Yeah, the Cleveland Clinic is actually really paving the way, especially for the spine surgery patient. So spine surgery is the most common surgery in the US and worldwide. And we are actually the first academic medical center that is making a class that helps people manage their pain from a behavioral standpoint. It's part of standard of care now. This is best practice. So the class was developed out at Stanford University. It's called Empowered Relief, and we've adapted it so that we can utilize it here at the Cleveland Clinic. So when folks are scheduled for surgery, their surgeon talks to them about the need to look at managing stress to help them utilize behavioral pain control methods, and they are scheduled for this class that's offered in a group format where they learn how to make a real difference on their pain by calming and soothing their nervous system, using mind-body strategies to help them interpret and redirect their pain, and also to prepare for pain control after surgery. There's actually been research that's been showing that this class in the orthopedic trauma population can reduce pain up to 3 months after surgery. So we offer this class for the spine surgery patient, but we also offer it for any patient that has pain that comes into the Cleveland Clinic. And the best part about the class is that it's a single session. So it's one and done. They get to spend a couple of hours with us learning these skills and tools, and most often are coming on the other side feeling like they have a sense of control and they're empowered to make a difference in their pain experience.
And they'll take those skills and those lessons along with them. So you touched on this too. How much does our mental health really play into ailments like a troubling back? You don't typically put those two together, but it clearly has an impact.
Most definitely. I mean, understandably, when something such as body discomfort gets in the way of living your life, of course, anybody would feel frustrated, potentially worried, apprehensive, stressed, maybe even angry. And neuroscience is actually telling us now pain is not just a sensory experience, it's both sensory and emotional. And so, in order to fully treat the whole experience, we have to attend to both of those factors. Pain is created in the brain, and so are emotions. And so, when we have intense emotional experiences, it impacts our pain experience. And so we really work with patients on explaining to them that model that's based in neuroscience, so they're really fully understanding why these kinds of psychological and behavioral approaches are of very high value to them.
Great information. The Cleveland Clinic always leading the way. Thank you so much, doctor, for sharing with us and spending time with us this morning. We appreciate you.